A pleasure to serve under your chairmanship. So I've had the good fortune of working with the ADHD Foundation due to the work of my constituent, Jane Roberts. This culminated in me following quite closely some of the ins and outs, successes and not, of the work for neurodiverse conditions. And we also had a very beautiful display in Stroud to raise awareness, where we had a number of colourful umbrellas throughout the town. Many constituents were asking, what are these umbrellas? And we were able to have those conversations about what ADHD is and what needs to change to support people. But I'm battling for Stroud District parents of children with special educational needs day in, day out. This means that I'm talking to the government, local authorities, councillors, ministers and health teams. But my efforts are nothing compared to the hundreds and hundreds of Stroud families who are battling every single day to be heard, with some really, really worrying decisions and situations for children, particularly when they're waiting for diagnosis or waiting for their EHCPs. One mum told me that her little lad with autism, he has an hour in mainstream school. So by the time he gets his little coat off, he's putting his coat back on again and having to leave. And we all know that a feature of autism is stability and having a steady day. And that is absolutely not what this child gets. So these parents, many of them are waiting for diagnosis for ADHD and autism. They are fighting to be listened to and just to get a way forward. They're fighting to find the right person to talk to, or even get a response in some cases. They're fighting for funding, they're fighting for dates, they're fighting to understand timelines, they're fighting for delays, and all too often they're being pushed into tribunals and getting into debt in the process. But they keep going because they are fighting for their children. And parents do not want their children labelled or medicalised, as so often raised in response to these discussions. They want them understood, and they want to have the right support in place so that their children can thrive. And on adults, I have often wondered how many of my peers, so I'm in my late 40s, so school in the 90s, Oasis, Blur, Cooler Shaker, Spice Girls, a long time ago now, many of us in all sorts of jobs, but how many of us would have had benefited from an early diagnosis of autism or ADHD when we were kids? Because it just wasn't discussed when we were at school. It was not something that was raised or thought through. So I'm not surprised that there's been a 400% increase on adults obtaining ADHD diagnosis, because this is something that is quite new to many adults that I talk to, and unfortunately that is the case. So the parents and the adults in Stroud who've talked to me about these conditions said that there is nothing more discombobulating than constantly feeling in the wrong job, in the wrong career, not having a place in their life, but not really understanding why. They're never quite able to get the right help. They're constantly changing things. It's diet, they'll add in exercise, they'll suddenly get medication, they'll come off the medication, but nothing quite helps. And again, the adults that I've spoken to who have had late diagnoses of autism and ADHD, they did not want to be medicalised, they did not want to be labelled, but they wanted answers. I will do, thank you.
Friend for giving way on that point. She mentions about adults and actually delays and not getting the diagnosis from years gone by. Is it not the case that actually it's because there's been a misconception from years up until now that actually ADHD is a signal of bad behaviour and not actually a medical condition?
I think my honourable friend is actually completely right, and he spoke very movingly about his own experiences and family experiences of this. It's incumbent on all of us in this place to try and raise awareness about what conditions are and how they affect people. And of course, with every individual being so wildly different, they are going to have different outcomes and different behaviours. We shouldn't write anybody off or put anybody into one single bucket. But the parents and the adults that I've spoken to, when they finally receive a diagnosis or they finally get to talk to somebody, it is of complete relief. And one woman said to me, it was, of course, when I looked up the condition, everything in my life makes complete sense. So we should have got there earlier in her case. So when the government is looking at this, I know that the ministers will be carefully studying the evidence and the data and the targets. You've got very smart people in the civil service who will be doing the same. But the data is wanting, as we've heard from many honourable members today, and so much is hard to quantify. How many jobs and careers have been lost from the failure to diagnose autism and ADHD early? How many lost opportunities? How many people are on depression and anxiety medication when clarity on their health through an early diagnosis could have helped them? How many people are secretly self-harming, and how many people have taken their own lives? And sadly, this leads to my constituent, Jane. Jane's son, Ben, sadly took his life in 2020. I remember early conversations with Jane during the pandemic, so we were on lockdown and Zooms. I would have fallen apart. I think she obviously has had some incredibly dark moments, but in response to Ben's death, she's dedicated her life to trying to raise awareness about ADHD. She's invested £30,000, probably even more now, to ensure that there is an early diagnosis of other children, and she funded the Umbrella project that I mentioned in Stroud. Another constituent, Safara Cormac, she's written to me about this. She founded the ADHD hub in Gloucestershire last year. Since lockdown, she's seen an influx of adults seeking diagnosis, and daily she receives calls from parents struggling with their children who are self-harming or are suicidal. There's no pathway for children and young people in Gloucestershire, although this is now commissioned for Gloucestershire, so we're hoping to see change. So I'm interested to hear from the Minister, who is a hugely compassionate and knowledgeable Minister. She's a nurse by background, and I want to hear her views in response to some of the questions raised by honourable members. But in addition to that, many people do talk to me about the lack of understanding and awareness at primary care level. GPs are often the first port of call when people have concerns, yet it's something that parents are concerned about, in particular about lack of training. So I would like to know from the Minister whether this is a feature of the work of the department and whether anything's been done about training in primary care. I'd like to also know how the Department of Health and Social Care is working with the DfE and local government, because we know that waiting times, daily experiences of parents are not often sitting with her department when it comes to education. I'm very, very interested in the pilots that the honourable member from Newbury mentioned, and we would very much like some pilots in Stroud if there is any going, because I would like to see a comparison of when there is swift and early diagnoses, how many children and adults are found to not have ADHD or autism because they've had early treatment. Because my biggest fear is that people are waiting so long that they're ending up in a very difficult place, and perhaps without education in the meantime. So my approach to politics is quite simple, because once you strip away all the drama in this very beautiful building and political parties shouting at each other, saying that the other side doesn't care or hasn't got the right ideas, at the very core of this job is problem solving and spotting problems as well. So when family after family is telling all of us across the House that GPs, the NHS, government, local government have not got quite the right policies to make sure that children and adults can thrive in this country during a time when we want everyone to be more productive and active, we absolutely have to act, and we have to get in earlier. And I am really looking forward to hearing from the Minister today.